Welcome to Expanding Access, a podcast by Behavioral Health Tech, where we explore the cutting edge of mental health, substance use, and autism and IDD care. Each episode features insightful conversations with industry leaders who are driving real change through technology and innovation. Whether you're a provider, payer, or just passionate about expanding access to behavioral health care, you won't want to miss these stories. Let's dive in. Hello, everyone. My name is Solomay Tibabu, and I am the host of the Expanding Access podcast. And I'm really looking forward to this great conversation today with Paige and Derek. Thank you for joining us. Can't wait to learn more about this important topic. Fraud, waste, abuse is on a lot of people's minds. Just to get started, beginning with Paige and then Derek, I'd love to learn how both of you got into this industry.
Hi, thank you for having us. So I've been a social worker for the past 27 years now. I started off in school settings for about 22 years. And it wasn't until I moved here to Texas that I met the company that uses Monolith in the school system and just really liked the behavioral health interventions and support that they gave to the community. So I kind of said bye to the schools and got out into a private organization and have been working there ever since.
And yes, I'll echo Paige. Thank you for having us. And my background simply is I wanted to be a physician, but my dad, who is a physician, said, no, you don't. So I became a lawyer who really is involved in the fraud, waste, and abuse section. I represent a lot of healthcare companies and compliance work to make sure that they're not committing fraud, waste, and abuse and conducting internal audits and things to that nature. And then when I met this company doing some different work, Monolith just blew me away with what it does and how it can help providers and frankly some of my clients and how it can help protect everyone from potential fraud, waste, and abuse, whether it could be accidental, just misunderstanding, or on purpose. But this program truly stops it from happening. So that's really what brought me to this realm as well.
Yeah, I can't wait to ask you more about that and just examples of the impact it's had. But Derek, if I could ask you, what is the state of fraud, waste, and abuse today for those who aren't familiar?
So as people may have heard at the beginning of the year, the new administration right now in the White House is really pushing fraud, waste, and abuse. They created a new entity, DOJ, who is supposed to come in there and weed out all this fraud, waste, and abuse. It is somewhat effective depending on the situation, but it is rampant all around. And again, as I stated a moment ago, some of it's accidental. Some of the people just don't understand that they're clicking the wrong button or they're using the wrong level code by mistake, not with the intent, the willfulness. And then unfortunately, you do have some that commit fraud and they're doing it for the gain of themselves and only themselves. So for those bad actors, it has brought a huge realm of everyone must be doing it, because if some are doing it, then everyone's doing it. And so it really puts pressure on those that are compliant to make sure that they are staying that way, because the industry itself is just what I call healthcare, an ever-breathing animal. It changes every day, the rules, the laws, the regulations. Every year there's new ones. So you really have to stay on top of it and make sure you conduct your end of the year research and self audits to make sure you are catching everything you can catch. One of the good things about the government is with fraud, waste, and abuse is if you do your yearly audits and you find a mistake, you can correct it with no penalty, no issues whatsoever. It's when you see it and you don't do anything about it, or you continue to do the same, that's when you get yourself in trouble. So it is something that it's on the rise, but I think eventually when everyone really understands the rules and the regulations, it will come down again to a flatter level where people, the focus can go on other situations and not just this healthcare situation.
Yeah, that's not a spot that I know our audience wants to find themselves in. And so it's important getting the right resources and support, which is a nice segue. Paige, if you could share a little bit about what is Monolith and how do you support MCOs and providers alike?
Yes, absolutely. So Monolith is a software program. So it really captures at real time the interventions and services that are provided by whether it's a medical company, whether it's a behavioral health company, anybody who really needs to capture the services that they do. It has a couple different panels to it, I guess you could say, capturing the work with the clinical notes, assessments are all collected into it. It also has an HR feature that helps evaluate the services that are provided and making sure that the clinician or the field worker that is servicing the client is on time with putting in their notes or assessments aren't getting expired and needing to be reassessed. In addition to it, there's data collection too. So the best part about Monolith is needed across the board through all different levels of industry. So as us as providers, kind of that baseline, but the insurance companies, those MCOs that we're servicing their members, they want to ensure that we are providing the right services and following the state guidelines. So that's where the auditing piece comes into play, that even our MCOs are able to receive login information so they can get into the system at their own time when they want, and they can do their own internal audit within the members of their organization. And then it even goes to a regulatory level as well, that, the federal government would be able to capture and ensure that the services are meeting those state standards. Also overseeing the insurance companies, showing that there is success within the program. So Monolith as a whole just captures a lot. The strongest feature that we have is the real time and being able to service. So our clinicians and our field workers, they have their own iPads that are connected. So exactly when you're linked in, when they're working with clients at that real time, that helps take away that fraud, waste, and abuse. So it's capturing them providing the service or doing the assessment and submitting those notes, and that the time is really allotted as they're logging in and logging off. In addition to that, the assessment piece of it. So for us specifically with the behavioral health services that we offer, we are able to capture 3 different assessments. There's the state assessments with the CANS and ANZA that is required, but we have some additional assessments that we use just to really get to know the needs of our clients and their families to do a more holistic approach. So what the assessments are able to do is after it's completed, it is pulled into to assist with the treatment plan. So you take away time that it takes for that clinician to create that treatment plan, to come down with a diagnosis for that client, as it kind of autofills the areas of the needs. And of course, there's opportunity for them to add on to the information, but it has cut down we call them DX. That's when they have their initial assessment to come up with the diagnosis and create that treatment plan. It's cut it down more than half. It would typically take 1.5 hours to 2 hours for our clinicians to complete it all from beginning to end. And really, it's come down to about 30 to 45 minutes. And that takes away from that paperwork piece of it and really allows the clinician and our field worker to have more engagement and more opportunity to talk with the family and to really meet them where they are to make sure we're providing the right treatment.
If I can chime in on that real fast, that's one thing that drew me to this program is as an attorney, as someone who has clients that need to do audits and things of that nature, this program truly is a safety net. It helps to make sure that every box is checked, every I is dotted, every T is crossed. It will stop you from moving on to a different section if you're missing something. It will red flag things that are innocent mistakes that some people may not know. Furthermore, the program itself houses all the regulations inside of it, whether it's Texas, Kansas, Missouri, or other states. The program could be designed to fit your state and your guidelines. So it's more of a reassurance, the cheat code, if you will, to make sure that you are capturing everything that you truly need to capture in your billings. So that way, when you submit them, you can be submitting them with assurances that you're getting A, the full value, but B, you're also not going to be hit back with questions or audits because you're doing it correctly.
What a great example. Thank you for sharing that. Just out of curiosity, where does Monolith pull its data from?
So Monolith pulls the data from the beginning with the demographics of the clients that we service. So you would be able to put in a specific report that you're looking for. You might want to know, at what county has the most needs for support within depression. And with that, you can be able to pull more specifics to be a needs addressed approach. It also provides the success of the program itself. So how is that client doing as far as meeting the treatment plan? It's not as subjective, but it's objective. And so there's very specific. It's not the person's opinion with that. A lot of it has to do with the lessons that we have is state required. So it's very black and white of what the state requires we're able to do and provide as far as interventions. But Monolith is able to track those interventions. We're able to pinpoint and graph and see where there's been success from visit 1 compared to visit 5. Or if there is a decline in success on maybe visit 3, you can hover over the graph, click on lesson 3, have that come up and really be able to see what was going on during that intervention. It could have just been a situational base. It could have been that the client had trauma and factors during the day and just were not successful, but it's able to truly track and make sure that they are meeting to that 80% level of success.
What about, if you could talk a little bit about how Monolith offers state lessons plan?
Yes. So for states like Texas and other states that have the program, it's based on Senate Bill 58. So the reason that our program became established is to meet the families before they go into crisis, to help support the families so there isn't need to be hospitalization. So within that Senate bill, they have Texas administrative codes that identifies who's able to service the community as far as those clinicians and field workers. It then has very specific trainings for those individuals on what they have to be certified in. And therefore, they're able to give you those lessons within those trainings. So we've been able to take the trainings and develop the lesson plans that are very specific and step-by-step to be able to assist our field workers and really help enhancing and capturing the skill that's needed. And within that, as the lesson plans are implemented and as they check of what intervention was done during that visit, that then turns into the progress note or the case management note, and it captures that. So it is very clear on what was done. And then there's some rating scales on how well the client, the parent, anybody that might be involved with it feels success for that visit. What were some barriers? And that's part of that tracking piece that gives us the data of the impact of it and improvement in the skill sets on the treatment plan.
Thanks so much. And Derek, you alluded to this a little earlier, but can you talk a little bit about what providers need to know in light of new policy changes ahead?
Yeah, so typically speaking, when you think of providers, they're usually asked about were services rendered. Did they actually see the patient? But now the system is asking for more. They're wanting to know, was it necessary? Was it compliant? Was there detectable, legitimate data provided to it? What providers are taught in med school is if you didn't write it down, it didn't happen. So they're really looking at the notes. And providers are having to go back and truly retrain themselves to make sure that they are covering the basis for those notes. Because again, if there's an audit, the patient may have a great outcome and it may have been necessary, but if your documentation doesn't show it, then that's going to be an issue, which is what Monolith comes in, because it does make sure that you are putting in the right information. You are checking the right box. They're looking at whether you're over-utilization. If you're repetitive, if you're doing stuff too often, there are certain regulations in states where you can only see a patient a certain number of times per month. And if you're doing that more often than you should be, then that's potential payment you're not getting, but it's also a potential overpayment that if you do bill for it and it's not caught by the system. So again, that's another warning sign that Monolith can truly help you out on and make sure you understand that. And then finally, for provider purposes, again, relating to Monolith here is that if there was an audit coming out, if there were questions that were being asked, you can easily go to this program. You can separate what documents you need. You can separate the timelines. You can pull certain information out of it that is not only readily available, but it's also in a in a manner, in a way that is easily transportable to the auditor. So they can see the issue, they can see the documents, and they can see that you're doing everything correct. Because in the healthcare world, there are audits just randomly that you're doing fine, but they're just random audits. And so if you're able to readily show the material, the documentation, then you can quickly get rid of those audits. And I can give you examples in the social work realm where, providers are seeing patients over and over. And so red flags tick off because of just the amount of volume potentially. But when you provide, and this is a true story, when you provide 14,000 pages of documents for a patient, because you're seeing them so long and it's to help them out, it was a quick, we have no questions. This is clearly necessary. Clearly you're doing your work. Keep it up. Way to go. So that's, again, what this program does. It's really document. And where I see in my realm of work where people get in trouble or really ask questions because their documentation is lacking. And so with a program like this that allows you to practice medicine and do what you're supposed to do, because all you're really doing is filling in the blanks that it provides you, it makes it much easier for the provider to do what they want to do, which is see patients. And Paige may have a little bit more to add to that as well, I'm sure.
Yeah, if I could piggyback off of that. One, back to the topic with like the MCOs and what does Monolith really offer with that? It's a very much a pull between the providers and the insurance companies with the amount of hours of service you're able to provide. And I mentioned before how Monolith takes all the assessments together and helps assist with that treatment plan. But when the intervention's being placed, they may only be working on 2 or 3 goals. And that's what the insurance company sees. So they're going to say, oh, you only need to have 3 visits to be able to achieve these goals. But we know 2 things. We know, one, everybody learns differently and everybody learns at different paces. So something that might take me 3 visits to be able to conquer might be different for Derek. And with that capture of all of the needs in the assessment, we're able to have multiple goals, even though it may not be the active one, but that's showing the insurance company based on these assessments, they don't just have 3 goals, they have 15 goals and the objectives that go with those goals to be able to accomplish. How are we supposed to accomplish that with 4 visits within a month? And so that documentation's huge. It is the advocate for the client to be able to help them grow to meet the needs for themselves. And then also just having the awareness be brought to insurance company that it's just not a one slated time slot for everybody. And it really just helps support that individual client to grow.
I'll also piggyback off of that and say that you're right. Paige is spot on when she said, it is for MCOs, but also providers. It really is for both. MCOs should want to use it or want to use a platform like it because it makes their job easier, because they can see what's been done in a one-stop shop, compliance to finance to the documentation itself. It's all right there. So I personally believe that MCOs would want to use it for their end because it's easy for them to do audits and compliant work, but also providers, it also helps them for reasons I stated earlier. And when both are using it together, the two are communicating, then you have a fully working system. Part of what we're seeing, or what I'm seeing in the legal world, is MCOs are not truly communicating with the providers. There is a gap between what the MCOs are looking for or wanting versus what the providers have been trained to provide. And that's what I go back to healthcare being a breeding animal, because it changes. But the MCOs, some of them, in my opinion, are having difficulty communicating with the providers. And therefore, it's putting the providers in a spot where they don't know what to do, or they're trying to do what's best for the patient, no matter what. And then they're finding out later on down the line, oh, you shouldn't have done that. But they didn't know. And they were trying to truly, in their heart of hearts, help the patient, which is what their calling card is. So I think it is something that can help bridge that gap between the MCOs and the provider as well.
These are all such great points. Thank you both. If I could just land on one more question for you each, let's just imagine a provider that is feeling a bit overwhelmed and wants to get more organized with their compliance. What's one step that you think that they can just start taking today? Maybe Paige and then Derek.
So it's all about the flow system. So Monolith is able to start from the very beginning with enrollment and intake, all the way through until it is time for discharge. So the challenge for providers is that documentation piece, and being able to capture that at the very beginning really helps make it more efficient and even help with time management as well. So with being able to have everything electronically on your hands, real life time stamped is quite essential when it comes down to the service that we're providing, and for us to be able to submit claims for the services for efficiency reasons.
My biased opinion is hire counsel to help as far as just making sure you are compliant, making sure your T's are crossed, your I's are dotted. But I also think it's important that providers communicate to the MCOs. And I say it's only going that way because personally, the MCOs are not going to truly reach out to providers. So I think it's imperative that the providers take the proactive step of reaching out to the MCOs to help get guidance and to help answer questions, because that's the only way the providers are going to get certainty. And Paige and I have worked together on, working with MCOs to open up dialogue. And when we're able to do it, we really can get something accomplished pretty quickly, because it appears they want to help, but the MCOs may not know necessarily what the providers are feeling, missing, misunderstanding. And so just that dialogue is huge. So along with, again, if it's not written, it didn't happen documentation wise, it's also important that you do the due diligence, you reach out, you ask the questions. As you learn in elementary school, in my opinion, there's no such thing as a dumb question. If you don't ask it, then you may not get the answer, and you need to get that answer. So my advice would be to reach out, use your phone, use email. There's all sorts of ways to communicate nowadays, and take advantage of that.
Excellent. This was wonderful. And thank you both for sharing your expertise with us. I'm excited for our audience to absorb all of this and take some steps to improve their compliance. Thank you, Paige and Derek. Thanks for tuning in to Expanding Access. We hope you're feeling inspired by today's discussion. If you've enjoyed the episode, subscribe and share it with your network. For more content and opportunities to get involved in transforming care, visit behavioralhealthtech.com. Until next time, let's keep pushing boundaries and expanding access together.